I'm Valerie Koeppen, and I work with Ramona Britt at Assisted Living Locators. So we are local and helping people find senior living care. So first of all, let's look at what has changed regarding placement. In-person tours is a big one. Right now, you can't go on an in-person tour, but you can go on a virtual tour. So that's looking many different ways. A Zoom, some of them are kind of like a FaceTime, and some of them are videos that people have already made, and you can observe everything through there. So that's one of the really big ones. There's a lot of traditional things that remain the same. You still have to have a doctor paperwork, TB skin test, and those kind of things are the same. Now there's a whole lot of new requirements, and honestly, it seems to be, depending on where you are, it varies across the board. I've seen 2-day quarantines, I've seen 14-day quarantines, and then there are other places that are asking residents to stay in the room throughout the duration. So it really kind of varies. There's also new requirements to get in. Some places do require that you have the COVID-19 test to get in and make sure that's negative. Other places might do it when you get there, and so you're quarantined until the results. So you're really seeing many different presentations of how everyone's handling that. Okay, let's look at visitation. Whoops. Right now, no outside visitors are allowed. So people are getting very creative and handling that. We have seen, as I'm sure you've seen on TV, window visits. Some locations are allowing window visits, and the person, they'll talk on the phone and they'll be able to see their loved one through the window. Just the other day, my girlfriend's grandma celebrated her birthday that way. They sent the cake in and they went to the window and they talked on the phone and sang her happy birthday. So people are getting, again, so creative. Also, some people are doing FaceTime visits like every day. They're seeing their loved one and talking to them so they can kind of get their eyes on them and make sure they're doing well. And then other places are setting up Zoom. So again, there's a big variation, but everyone in the assisted livings understand that it's important for you to stay connected with your loved one. So those things are being set up. Doctor visits. Now that's another issue. A lot of people are choosing to see the in-house doctor right now, because if you go out to visit a doctor and you come back, some places are requiring like you be quarantined for 14 days to make sure you didn't get exposed to the COVID-19. So obviously, if you have a specialist appointment, a neurologist, a cardiologist, any of those specialists, got to keep those appointments. So you would just need to, your loved one would need to go ahead and keep that appointment, and they might have to be quarantined, just depending, again, on that specific policy of what you're seeing. Okay, move-in day is looking very different. Used to, the whole family could move you in and they could hang your pictures and, you know, put everything together how they wanted to see, but that's not quite how it is now. So some places will allow a small family member group to move you in full PPE. That's protective, you know, protective gear, like masks and coverings of the shoes and stuff like that. Other places are saying deliver the items to the door and the staff will do the move-in. I talked with someone yesterday and they say the stuff goes to the door, we disinfect it all, it has to dry, and then they'll move it into the building. So that's kind of what we're seeing with items. One thing, regardless of whether you're in COVID-19 or normal days, is we have really seen how important it is to have the room set up in advance. I can't stress this enough. It is so important to have like the pictures in place, the bedspread on, like little items from home to make the place cozy and make it feel like home. And we've seen such a better adjustment when that is in place versus situations where the loved one has been taken in, and in midst of the whole chaos of, the stress of getting the room decorated. That just doesn't, especially if you have dementia on board, doesn't seem to be a good fit. So I really suggest that you have the room prepared in advance. And obviously, since they're moving in the stuff for you, that's going to be easier. But as times change and go back to things that we've known before, I just want to suggest to you that you always think about that, having that room set up and then bringing in your loved one after it's homey and it's not stressful. So next, I want to talk to you about emotions impacting placement decision. There are so many emotions that you go through when you're trying to decide about placement. I think dread is a big one. Perhaps your loved one said they never wanted to go to an assisted living or any kind of care like that, and you don't want to be the one to make the decision. I've seen people get creative with this too. They ask the doctor to be the one that says that their loved one needs to go. And if things have changed and it's medically connected, that the doctors can be helpful in that way. I had a lady who, her mom was dehydrated and she had to be hospitalized. So the doctor used that opportunity to suggest the assisted living. And so for the daughter, that took off that fear that she was the one making it happen, and it just helped her. So people sometimes need, just help with that. Confusion and feeling overwhelmed at the process. We see that a lot. There's so many choices, so many prices, and just so many things to kind of discover and figure out. And let's be honest, you're already wearing many hats. You're a caregiver, you're either a spouse or a child, and then you may have a job. You are trying to keep the house running, you're trying to pay the bills, and then you're trying to make sure that your loved one gets all their needs met, their daily living ADLs taken care of. So you are wearing many hats. Disappointment, we see that. Disappointment that dementia is the road, that your family has to go on. And it's just hard. And, we work with people whose loved ones are just may not recognize them anymore, that can come to that point. And so just disappointment that that's the road that they have to go. Rejection is another struggle. Just they don't want their loved one to feel rejected. In reality, sometimes we see that they really don't have that reaction. They actually often prosper just being in that, very structured setting. So loss, I think some people have a fear of loss, a fear of a daily routine changing the details that they've gone through, and just afraid that things just won't be the same. Let's face it, if you've been married 40, 50, 60 years, you've been with your loved one all this time, and it's going to be very difficult to make that transition. So there's grief involved, and allow yourself to feel that grief, to experience that grief, and to work through that. Those are valid emotions. Some people deal with guilt. Sometimes they impose that guilt on themselves. And sometimes that guilt can come from well-meaning people. I've heard people that I've worked with say, that somebody at church told them they should never put their loved one in any kind of senior care. But let's be honest, unless you've walked a mile in that person's shoes and know what they're going through, you can't really speak to that, because that may be the best thing for that person, the caregiver, for their health and for their loved one. So sometimes people mean to be helpful, but they don't really know because they haven't walked the walk. Anxiety is another one that I've seen people feeling anxious, haven't made the right choice. Is this the right place? Like, how are things going to work out? Just kind of that, how we can all get on that like treadmill kind of thing. Sadness is another thing we see. Concern that bond won't be as strong, or fear of losing that special relationship, when in reality, what we do hear from people is, now I can be the daughter again, or now I can be the spouse again, and I can just focus on that part. I don't have to be the caregiver anymore. So that can be a flip side of what people are afraid they're going to lose. Actually, they can gain. Depression is another one. This is a very intense place, being a caregiver. And sometimes you can just get very tired and very worn down and just kind of stuck. Like, you feel like you don't have the energy to pursue this, or to go there. So all of these, you can see the puzzle that I have presented before you. All of these are interconnected feelings, and they're normal. And I think I have taken a long road with people before, and it's taken them, they've had to go through those emotions and kind of deal with those emotions. But I think it's important to go ahead and face those emotions and process them, and talk about them, so you can get to the point where you're at peace with the decision. Because it's very important for you to be at peace and be able to know that this is the right thing for your loved one. So some other obstacles besides emotions are obviously budget. Budget can be a big issue because it's expensive. Another one is, it's so important to have one person in charge of gathering the information. I can't stress this enough, because I've seen so many times, especially with siblings, one sibling's going this way, another's going this way. I think it's very confusing. So if one person decides they're going to be the point person, everybody needs to be on board. Everybody needs to agree what's important for mom. Like, are we looking for, a specific kind of place, like a specific decor? Some people, decor is really important. Other people, activities is important. Other people, food. So go ahead and decide as a family what is important. What are our key top things? So everybody's on board. And then you go back to the family, that one person who's in charge of gathering the information, and present it and say, okay, let's as a family make this decision. So you're all in it together. Medical paperwork, sometimes that can hold up, because it usually takes about 2 weeks, because you've got to get the TB skin test, you've got to get the doctor to fill out the paperwork. Some offices do it really quickly. Others, it just kind of lays in the back room, somewhere. And so you have to kind of stay on top of that and call the nurse and facilitate that. So how do I know it's time to make a change? If you have a loved one that lives with you, if you've gotten to that point where you just can't take care of their needs and yourself, it's time to start thinking about placement. A lot of caregivers have very negative impacts on their health, and honestly can end up with conditions that are very detrimental to their own health. So you don't want to get to that place. You have to put on your own oxygen mask so that you can care for your loved one. Caregiver burnout is a very real thing, and it can just start to take such an effect on you, and you don't realize it. It's sort of like, you've heard that analogy, if you put like a frog in hot boiling water, he would hop out. But if you put a frog in water and slowly turn up the temperature, he doesn't realize the change. And caregiver burnout's kind of like that. It's like you're just slowly increasing the stress and slowly increasing the tension, and you don't realize often what you're in until you've stepped out of it. And I've had a lot of people come back to me, I did not realize like how rough this was for me until now I've stepped out of it. So that's kind of an analogy. Fall risk is your loved one falling a lot. Wandering away from home with dementia, you can see that, where they're often going home, but it's to their home, of your younger years. Safety issues, this one's huge. Loved ones that turn on their water, when they don't turn it off, or they turn on the stove and things start to burn, those kind of things. So those are issues that we see if your loved one lives with you. Now let's look at if they live by themselves. medication mix-ups. This is a really important big one. With medication mix-ups, you can really have issues of safety. One of the big things I see with dementia is the loved one goes to sleep. They've taken a nap. They wake up. They think it's the next day. Like they took their medicine Sunday morning. They think it's now maybe Monday, and they take their medicine again. Or they forgot that they took their medicine, so they take the next day's medicine because they can't remember which day. So medication mix-ups can be really huge. Food issues, this can be really important because if the food is spoiling, you can have a situation where your loved one eats the food and actually gets food poisoning, ends up in the hospital, and then actually gets other complications. So food poisoning is a big issue. Also, with dementia, at some point, your body does not realize that you're hungry, or it thinks you're very hungry. And so you can overeat and start to really gain weight, or you can undereat and start to really lose weight. And so one of the things you need to be looking for is a real change in weight, either up or down. Getting locked out of the house is another one. Often they might even have a key, like even under the mat, but they forget that it's under the mat. And so they can't get back in. And maybe they had their cell phone and they called for you to come get them, but then they go sit in the car and it's hot, and that's just not safe. So things like that, when you have the dementia on board, situations that could normally easily be taken care of can become more of an issue. Dehydration is another big one, and Dr. Macy Smith talked about that earlier this month. But that is a big one where not drinking what they need, and so they can get dehydrated, and sometimes that can lead to hospitalizations. Also, if you're seeing a pattern of hospitalizations, you want to ask yourself why. Again, these are other things that can point to it's time to consider placement. So let's look at the options for senior living communities. First, let's look at assisted living. So assisted living includes a monthly room rate, and you get light housekeeping. Most of your utilities are paid. You get to go to and from the doctor. You get activities that are planned, 3 meals a day, and snacks. Now, not only are you paying for the room, but then you're also paying for the care level, okay? So a nursing assessment is the only way you can know what level of care you are. That can start like care level 1 and go up to 3, or I've seen it also go from care level 1 up to 6. So the more care you need, the higher the price. So it starts lower, sometimes $300 or $400, and it could go up to $1,200, $2,300, that kind of thing. So again, you're paying for the room plus the care. All of assisted livings are DHEC monitored in South Carolina. So they come in annually and check on things. And they have to follow regulations, DHEC regulations, in order to keep their license. Okay, so the care levels that I've taught you about that cost different things also include medication management. Now, I want you to realize that some places charge an additional fee for medication management. Other places, that is included in your care level, but that's one thing to keep in mind. That may be an extra expense on top of the room, the care, plus the medication management. So just keep that in mind. Bathing, dressing, grooming, that looks differently. Your loved one might need what's called standby assist, which is you have a person standing right here just to make sure they don't fall in the shower. And then there's a higher level of care where someone's actually giving them a bath. Incontinence management is important. Some places that is an extra fee. Some places charge for supplies. Other places just ask you to provide them. Toileting assistance would just be when they're helping your loved one get from the bathroom, to the room, or from the wheelchair to the bathroom, that kind of thing. Transfer assistance. This is really important because in order for your loved one to be able to stay in assisted living, they have to be able to pivot and turn. So it's sort of like you stand up and you can pivot, and then you can turn and sit. That's really important. Let's setting up the food and cutting food is something they can do, but they cannot feed your loved one because DHEC will not allow that. That's considered a skilled nursing activity. Mobility assistance, does your loved one need help getting from their room to the dining room, that kind of thing. They need help with their walker. That's the kind of thing. Laundry is also included, and that's just kind of included. Often, maybe twice a week, they'll do your laundry. And then if there's an accident or something, they will handle that more quickly. Okay, so basically, memory care is everything that I just talked to you about. And it's like assisted living and these things. So you get a specially trained staff who knows how to redirect but not confront your loved one. They are not going to be focusing on arguing or telling them they're not right. They're going to instead meet them where they're at. You get special programming. Each place should have special programming for activities that would enrich their minds and help them do crafts and help them engage socially. You're also going to get like a keypad so they can't just walk out the door. So they often will give you the family when you're able to go visit, like the number so you can just go in and out. It's important when you're leaving to make sure that no one's right there with you. And some places even have a new thing like a special hall where you go in the hall and then you make sure the door's closed and then you go to the next level. So that some places have that. But still remember that because it's a place where you have to be able to get out of the door for a fire, people can still get out the door. But typically there's a delay, which gives staff the opportunity to get to the door to stop the person from leaving. So, and a lot of memory cares will have an outdoor experience where you can go out and you don't have to get permission to do that. You can sit in rockers, you can look at flowers. They even have like sometimes beds for them to garden in. So a lot of places do have a nice outdoor experience that is protected and it's not like they can wander away from. Typically, most memory cares are what we call all-inclusive. That means you're not paying a different price based on their level of care. Because the memory care is a higher level of care, you're just going to pay like a higher price than just say assisted living typically. So, but you won't have to spend, like your level of care typically won't change. There are a few exceptions, but overall. Now, how do you choose a community given COVID-19? So what I suggest these questions, what steps are they taking to protect the residents and staff from the COVID-19 virus? That's really important that you know what they're doing. I want you to understand what their fall policy is. A lot of times if a person falls and no one sees it, they have to go to the ER. Well, we all know going to the ER is a different experience now because you can't go with your loved one. So you sort of need to know their trail, how that's going to work. Now, typically, the people at the assisted living can't go with you because it messes up their ratio and then they get in trouble with DHEC. But of course, you would want to make sure that they're going to communicate that your loved one has dementia, and it's important that they know that the people on the ambulance know that and the people in the ER know that, so that they can take extra precautions. So I would also really stress asking about their activity schedule because given the COVID-19, again, I'm seeing different things in different places. Some places are doing activities with just like 2 or 3 people. Some people are having them stay in their room and maybe the activities director would come to them. But you just need to understand what it is that's happening. How will I get regular updates? You still want to know and have your finger on the pulse of what is happening with your loved one. So establish with them how often that's going to happen and how to do that. And then how can I interact with my loved one? Like, are we going to do like a window visit? Are we going to do FaceTime? And again, with dementia, you've got to consider, is the window visit going to be disturbing or confusing to your loved one? You know, is it better to do it on the phone? So you just have to sort of make sure you figure that out as you go, and look for signs if it's agitating. So the big question on everyone's mind, how do I pay for assisted living and memory care? Typically speaking, it's mostly private pay. You can use long-term care insurance if you have that. Some people who have served in a time of war can get VA aid and attendance depending on their level of money that they have, and sometimes a spouse can also get that. You can use, obviously, your Social Security, savings, investments, those kind of things. And if you have a lower amount of money, then you can see if you're eligible for what's called Medicaid OSS. And that's all through the Department of Social Services. You go in, you tell them situation, you have to provide financial documentation. They look back for about 5 years to make sure that money hasn't been spent inappropriately. And if your loved one qualifies, they get what's called a Medicaid OSS number, and then you have 30 days to get them a room. And if you can't find a room in 30 days, you can reapply for more time. That's not a problem. Okay, so I want to talk to you now about some positive caregiver reactions that we've seen after placement. For some people, they're feeling very relieved. For others, we've seen an improvement in their mental health. Others are feeling stronger and rested. My own grandmother was a caregiver of my grandfather. Actually, no, her father. I remember she told me he had dementia, and this was back before there were assisted living. She told me I literally had to tape my ankles because I was so tired. She was like, and I would look out the window. She worked at Haynes. I would look out the window at Haynes, and I would just stare off because I was just so exhausted. And so we all know it takes a large toll on our health. Improvement in strength, feeling rested. What's delightful to me is when I hear from family, I found the fun again. I am now the daughter again, and now I'm taking mom to get her hair done, and we're going for a bite to eat, and I don't have to be the one who's playing the hard role of telling her, no this, no that. And so some people, they find, a relief and joy in that. I've also seen real relief in the job stress, marriage stress, because let's face it, when you're going through all of that, you have a lot of stress on your shoulders. And so it's really helped some people reduce those stresses. And it's also reduced caregiver burnout, where they just didn't have it to give anymore. So skilled nursing, I want to speak to that just because a lot of times your loved one can be cared for in the memory care, and they can walk the walk with them through life, and they can bring in hospice or whatever when it's end of life. So many times you're going to be able to have everything you need right there. But there are situations where a skilled nursing situation would be needed. And again, DHEC regulations say if you have sliding scale insulin, that you need to be in skilled nursing. If you're unable to pivot and turn, like we talked about before, to get into your wheelchair or to get into your bed, that's skilled nursing. If the weight is such that you can't be safely lifted by staff and a Hoyer lift is required, again, skilled nursing. If nursing care is routinely needed, skilled nursing. Intense medical needs, skilled nursing. And if you're bedbound, and I don't mean just for a sickness, but bedbound like you won't be getting back up, again, that's skilled nursing.